It's been 6 months since the coronavirus has been here in the U.S., and it has pretty much and continues to affect every aspect of daily life. Yesterday, more than 60,000 new cases were reported, and there's a bit of a silver lining there because that's a drop from a peak earlier this month when we saw nearly 75,000 new cases in a day. Still, 7 states and Puerto Rico did report record highs for coronavirus-related hospitalizations on Monday. CBS's Laura Podesta has the latest.
With the number of COVID-19 cases rising steadily in much of the country, the White House says it's bringing back its daily coronavirus task force briefings.
A lot of people were watching, and that's a good thing.
President Trump says he'll take part in the events just as he did in March and April.
I think it's a great way to get information out to the public.
The president and some governors are still pushing to reopen schools next month. On Monday, Florida's biggest teachers union asked a judge to block the state's in-person schooling plan until class sizes are reduced and protective gear is provided.
Failure to wear a mask could lead to a shutdown in the state of Texas.
More than 10,000 COVID-19 patients are currently hospitalized in Texas. With available beds running low, the Austin Convention Center has been converted to a field hospital. It opens today.
Here in New York, once the epicenter of the pandemic, officials are keeping a close eye on the state's coronavirus numbers, as well as people flouting social distancing rules.
If you have congregations of people, they are going to spread the virus. It's stupid what you're doing. It is stupid.
Governor Cuomo said he would order bars and other venues to close if people continue to gather in large groups. Laura Podesta, CBS News.
All right, so we're going to take a closer look at some of the major medical news and major developments surrounding the coronavirus. There's a new study out that takes a closer look at school-aged children and whether they are susceptible to the virus and whether they can spread it. That's coming out of South Korea. So I want to bring in New York pediatrician Dr. Dyan Hes to talk a little bit about this. Of course, this is a hot topic right now, Dr. Hes, because, you know, a lot of schools are considering how they're going to move forward when it comes to reopening. And so they're not just considering the health of the students, but also the teachers. And, you know, these kids come back home. So the parents and grandparents who are at home. Can you tell me a little bit more about this study? It differentiated between children who were under the age of 10 and over the age of 10.
Right. And it only tested contact tracing patients who were symptomatic. It didn't test the asymptomatic patients. So it's an okay study. It's not a great study. And the author acknowledges that. It's not surprising. We just haven't been testing children in the United States. So we don't really know the numbers. But you have to remember that when kids had been going to school during the pandemic, when it first started, they weren't wearing masks. So if we're going to send our kids back to school, we're going to send them back to school with precautions. So if the kids wear masks, if they have good hand washing, if the teachers are wearing masks or face shields, you know, you're going to decrease the spread. You also have to remember in different countries, like in Korea, you oftentimes live with your grandparents, much more than we do here. And those are the very susceptible, you know, population, the elderly. So, you know, you have to weigh each district, each area, the prevalence, like if you're in Texas or in Florida versus New York, where the numbers are very low, and how are you going to reopen, how many kids you're going to allow in the school. But we're going forward, we're not going to make those mistakes. We're not going to send kids to school without masks. We're not going to have them not washing their hands. We're not going to have them eating in a giant cafeteria packed with 300 kids. So we have to learn from that, but I wouldn't say that this is a reason not to send kids back to school.
And just to clarify with people about the details of the study, as I understand it, sorry, Vlad, because we didn't actually sort of say what the conclusion was of the study, but it essentially concluded that children under the age of 10 were less likely to spread the virus versus children over the age of 10. And 10's, you know, pretty young. My kid's 9, so we're talking about 4th graders and above may be able to spread the virus the same way adults do. But as you point out, it's not a perfect study.
Yes, and you have to remember that little kids, and we still have been seeing this in New York, I always remind everybody, throughout the crisis in New York, we have had daycare open for first responders, for parents who have to work, and we have not had an outbreak because we have been using hand washing, masks. You know, there were the 2 hairdressers in Missouri who both had COVID and they wore masks and they cut hair of 145 clients and everybody was masked and nobody caught COVID from them. So like we're looking back and seeing how it was spread, but now we're going to go forward and use, public health measures to reduce the spread. So we knew that kids could spread it. I've been saying this all along. It's just that we weren't testing them, and now we are.
So, Doctor, I want to reference Dr. Jerome Adams. He's the U.S. Surgeon General. He joined CBS this morning to discuss the reopening of schools. He's also a member of the White House Coronavirus Task Force. Let's play a little bit of what he had to say.
The biggest determinant of whether or not we can go back to school actually has little to nothing to do with the actual schools. It's your background transmission rate. And it's why we've told people constantly that if we want to get back to school, to worship, to regular life, folks need to wear face coverings. Folks need to practice social distancing. Those public health measures are actually what's going to lower the transmission rate. And we've seen in Norway, we've seen in Denmark, that when they start with a low background transmission rate, they were able to safely reopen schools with minimal to no transmission among young people, particularly people under the age of 10 or 12.
What I find remarkable, Dr. Hes, is that here's what I find remarkable about what you hear frequently from members of the Trump administration and the Coronavirus Task Force. It's this incessant pointing to what is happening in other countries to then indicate steps that we should take in this country. But no other developed nation has sent children back to school with the coronavirus at the levels that the United States is seeing right now. So you can reference Norway, or you can talk about Denmark, or you can talk about France or any other country. They don't have levels of 60, 65,000 new cases of infections every day happening in those countries at the moment they decided to send their kids back to school. So what are your takes on the Surgeon General's comments?
Well, I agree with everything he said right now and it's about the prevalence in your community. And that's what I had just said, that, we can't compare New York now, where the numbers are low, to Florida or Texas or Arizona. And that's because we've had no national plan this whole time. Trump decided to wear a mask yesterday and everybody's like, wow, he's so patriotic. Well, it's 5 months a little bit too late, because if we had a national plan, we could have shut this down. Like, we talk about this every day, all the physicians. If everybody just wore a mask like we did in New York and stayed home for a month, we could, but people didn't listen. It's public health 101. We wear a seatbelt. We don't smoke in the cars with our kids. There's no smoking allowed in a mall. This is public health. That's why you have to listen to your scientists. So it's very aggravating that the children are going to suffer because parents have not been wearing masks. And I literally just got off a text message with another a teacher who just said that, they did a survey of her school where 40% of the teachers don't want to return back to school to teach, but that one of the same teachers is very vocal about not going back to teach, posted on Facebook in a crowd on a beach with no mask. So, people don't practice what they preach and they're ruining it for the children.
Oh my goodness, doctor. Yeah, it's stunning. There's this kind of disconnect, I think about when we use the analogy of like driving, because we've used it before with the seatbelts, that, everyone always thinks that everyone else is like the worst driver on the road, and they never recognize when maybe they might have cut somebody off. It's just, it's so everyone thinks that it's everyone else that's being reckless, and it's not them. All right, let me ask you just about a few more headlines, because I know we got to let you go at some point. I've been seeing these headlines since last week about pregnant women and the possibility that they may be able to transmit the virus to their unborn child. What do we know about that?
So we are seeing more and more cases of fetal loss or early deliveries, and the mothers are testing positive for COVID. So being pregnant is a relative state of immunodeficiency for many women, and they are more susceptible to catching COVID. And it is not surprising that COVID attacks the placenta, gets into the breast milk, gets into the amniotic fluid, because COVID goes for vessels. So a placenta is 3 vessels, that are 3 vessels through the umbilical cord feeding the placenta. So if you're having clots in your other parts of your body, it's not surprising that you would have restricted blood flow to the placenta. It's very sad. It's tragic. Remember that there are many viruses that affect children. We saw it with Zika. We have something called TORCH, which is toxoplasmosis, rubella, herpes virus. So we know that viruses particularly attack the developing fetus. And, this is just another another thing that coronavirus has found that the doctors are going to have to treat now. So we're going to have to watch these mothers who are positive. We're going to have to watch their babies going forward. They're all going to have to be in studies, and we're going to have to see how they develop and if they're developing normally and what are the effects. It's all so new.
Dr. Hes, I don't know if you saw the headline from the Texas Tribune a couple of days ago that in Nueces County in Texas, that 85 babies under 1 year old have tested positive for COVID-19 since mid-March. And there was even an instance of one child, a baby boy that was younger than 6 months old, who tested positive for COVID-19 and then subsequently died. And I think the story was important because it was a way to illustrate that despite what you might sometimes hear from President Trump or others, that this only affects a certain segment of the population, everybody it appears to be is vulnerable to COVID-19. The question is, what kind of concerns would you have, should a parent have if a baby under a year old tests positive for COVID-19? Can they spread it? Can they die from it?
Just like die from the flu, or you can die from para-influenza, you can die from viruses. But what the studies have been showing is that children are really not dying from COVID. They're actually doing very well, and they're so mild that most of the time when we're testing the kids, it's because the parents had tested positive and you wouldn't have even known that your child was positive. So in my practice, the only few kids who've tested positive, we only knew they were positive because their parents were exposed, and most of those kids either had no symptoms or just diarrhea for a day. They weren't critically ill. So it's very few children are critically ill. So I don't know the data from Texas. I don't know if that patient had congenital heart disease or had another underlying illness, because what we're seeing is most healthy children are doing fine throughout this. It's not been as serious in adults. And we can see that with numbers. We're just not getting the hospitalizations. They're not flooding doctors' offices. What I worry about is in the fall, how we're going to handle every kid who has a symptom of coronavirus running to the pediatrics office to get cleared to go back to school. Do you keep them home for 14 days? That's going to be a bigger mess. But right now, we're not seeing, thank God, we're not seeing that it is super dangerous in children. They can be spreaders. It's more likely over the age of 10, definitely in teenagers. But these are also the children who can tolerate wearing a mask, listening about washing their hands. And in the younger children who are not spreading it as much, the teachers will be wearing a mask. So we need to get the communities that have controlled the virus back into the school, because kids are not flourishing at home. We have high rates of child abuse. We have kids who are living below the poverty line who are not getting fed. And we have children who are special needs and not getting their services. So we need to get some of these kids back into schools. We just have to do it in a staged, correct way. And we have to give the families the option, if they don't want to go back to school, to stay home.
Really good advice. Dr. Hes, always great to talk to you. Thank you very much. We appreciate it as always.
Thank you.